Hey everyone, good day to all. Myself Dr. Ajay Maurya. Today onwards, I'm going to start a series of FMG high yield short shot 150 plus topic series. And myself Dr. Ajay Maurya. I just cleared my FMG in July 2024 in the very first attempt. Last time also I gave around 150 plus topics and the MCQs and also so we got totally 60 plus. We got total 60 plus MCQs in the examination by God's grace. Okay, so guys, for the PDF, you can just get from here. This is going to be the part one. This is going to be the very short session. This one, and the next session we'll talk about the more and more. Okay, so guys, they are the reviews which I get from the January 2025 of the FMG exam. So these are all are they are under me. I stayed with them for the 6 months. Okay, they finally did their best and they finally as a doctor. Okay, so you have to also work like this one. Okay, so guys, how this 150 short is going to help for you. Okay, so guys, this is say I know that I told that there is a 60 plus MCQs came from the my PDF in the John examination, and guys is helpful for who did minimum one time rapid revision. Okay na, so no need for that one also, just try to follow these topics. Okay na, and also see guys my all these topics are not in a subject wise, because you know why, because in the examination they're not going to ask like in a like subject wise. Okay na, the first MCQ will be pediatric, second will be surgery, like this they all are mixed. That's why my aim is also that I have to provide all these topics as a mixed type. Okay na, so you have to revise like this only. Okay na, we are having total 150 plus topics to revise. Okay na, every day I will cover all these topics within 10 to 15 days. Okay na, please stay with me. Okay, you must know all these topics before going to the exam. Okay na, so guys, my hard work is always dedicated to your success only. Okay, okay guys, so let's start the session. So guys, the first one is the see last time also from these slides, from the first slide itself, there is a two MCQs in the examination. Okay na, GCS and there is a acute and chronic malnutrition. These two topics are in the exam. I was shocked, you know what? So you can see here. I will let you know this one. Okay, done. Okay, क्यों याद नहीं रहा था वो? Okay, okay, done. See here. Mm, okay, first one is the GCS, it is the Glasgow Coma Scale. What is GCS, guys? Okay, this GCS scale is used to evaluate the patient is consciousness level. Evaluate the consciousness level in order to provide the better treatment. Okay, na? See how they are going to ask the questions about the GCS scale. Suppose example, a RTA patient came to the ER, and you have to assess the patient consciousness level. You have to ask the following question. GCS score include EVM. EVM means what? Electronic wandering machine. Electronic voting machine. Like a E for eye, V for verbal, M for motor. You have to check these responses. I, verbal, motor responses. EVM 456. The highest score is 4, and for verbal is 5, but the motor is 6. EVM 456, EVM 456, EVM 456. Okay, na? So guys, see here for the I. So a patient came, if the patient is talking, if the patient is responding, okay, na? Hey, bro, hello, bro. Okay, he is looking. Spontaneous, then you have to give the 4 marks. If the patient is opening his eyes by sound, oh, then it's a 3. The patient is opening his eyes by pain, with the pain, then it's a 2. Opening his eyes by pain or pleasure, it's a 2. If the patient is not opening his eyes with anything, sound, pain, nothing, then it means you have to give the score of 1. Okay, done. Next, guys, it is the verbal responses. How you are going to check the verbal responses? Okay, if the patient is conscious or oriented, then you have to give the score of 5. The patient is confused. Goodness, where I am? मैं कहाँ पर हूँ? Okay, it's a 4. If the patient is using words inappropriately, like he's using bad words, okay, now something about like inappropriate words, okay, then you have to give the 3. If the patient is what? Showing deep reading, like the patient is having like different sound or response, like like this sound is, okay, then it is a 2. If the patient is not having any responses, then you have to give the 1. Got it? See how to remember this one. See, one confused word. See, one means O means one confused words. Sounds however. One means O oriented. One confused words. Sounds however. You have this mnemonic to remember. Next is the motor responses. The patient is obese. Okay, 6. The patient is localize the pain. Okay, 5. The patient withdraws normal flexion. 4. If the patient is abnormal flexion. Okay, na? Instead of this, like he will do like this. The abnormal flexion extension. Okay, the patient not responding. It is the 1. This is how you have to remember. Okay, I think these 2 are very easy, but you have to remember this one only. Okay, so let's try this one. Okay, this one, try to calculate this one. Calculate the GCS of a patient exhibiting the eye opening on painful stimuli. How much it is the painful? 2. Confused? 4. Exhibiting flexion on painful. It is the normal flexion. That is how much, Nana? How much? 4. Total is the how much? Total is the 8. Chichi, total 10. Okay, 10. Total is the 10 GCS. Okay, na? See here, mild is the 13 to 15, moderate 9 to 12, severe less than 8, and dead is the 3. Remember here, if the GCS is less than 7, then what to do? You have to immediately intubate the patient. You have to intubate the patient. Okay, got it? Next, see here. See, this is the severe acute malnutrition. Sometimes they will just call as SAM criteria. It is a SAM criteria, severe acute malnutrition. Okay, so how you are going to diagnose the patient as the severe acute malnutrition? This is a topic from the what? Topic from the pediatrics. So this is the criteria. It is the children age must be more than 6, must be more than 6. There is a bilateral pedal edema, and the weight for height is less than -3 g score. Remember here, this is the weight for height, not the height for weight. This is the weight for height. What लगा देंगे इसे? What? Weight for height. Weight per weight to height. Okay, less than -3 g score. This is MAC, mid arm circumference value must be less than 11.5 centimeter, must be less than 11.5 centimeter. And how you're going to treat? Because we have to treat with the IV fluids, and the regular lactate with the what? With the 5% dextrose solution. This is what you have to remember for the SAM. Okay. Next one is the guys is the how to remember the acute and the chronic malnutrition. Okay, na? Remember the mnemonic is हवा. लाल दुपट्टा उड़ गया रे तेरे हवा के झोंकों से. हवा. See, हवा. Means see height per s, weight per s. Okay, na? See, there is a low height and age. There is a low height per age. It means patient is having chronic nutrition. Yeah, chronic nutrition. There is a low weight per age. It means the patient is diagnosed with a chronic plus acute malnutrition. Okay, and then remember this one. Weight per height. Weight per height is a acute malnutrition or wasting, severe wasting. This is how they are going to ask the questions in the examination. They will give low height per age, chronic nutrition. Okay, chronic malnutrition. This is how you have to remember. Okay, na? Done with them. Next, coming to the headache. Okay, see, this is the tension type. This total 3 headaches. Tension means what? Tension, it is more common in females always get more tension. Okay, now see, tension is more common in female. Tension is like what? It's a band. It's a band like compression. Someone is compressing the head. Oh my goodness. It's a band like compression. Bilateral. There is a no nausea, no vomiting this year. Just a band like someone compressing. Oh my goodness. So you can just drink coffee. Drink coffee, ra. Coffee also you can take the NSAID. Naproxen is the best one. Naproxen, ibuprofen. Okay. The next one is the cluster headache. Cluster type headache. Okay. See cluster, luster, cluster, luster, lust. We see lust. Lust is more common in obviously male. Lust. When there is a lust, there is a white drops. Okay, that's why see here. See cluster luster means remember like this one. Lust is more common in male. See the cluster headache is more common in male. There is a unilateral headache. Okay, now there is a history of cry. See here there is a if there is a what? There is a needling. There is a piercing. Someone is piercing the needle like that. Like that is there is a pain. Someone is needling. Okay, na piercing pain. That is a piercing pain, and also there is a trigeminal neuralgia. It's going to be very painful here. Okay, now. And also there is a secretion of tear. There is a secretion of tear lacrimation, as called lacrimation, which is called as the epiphora. That's why whenever patient came to you with the headache, you must ask the history. Is this a band-like compression? Is there anything? There is vomiting or not? There is a history. There is a secretion or not? You have to ask like this one. If there's a needling type, okay, na, so you have to give it is the cluster headache. You have to do a treatment, sumatriptan and the high flow oxygen. And also remember the prophylaxis, it is the CC, that is the calcium channel blockers, it is the varapamil is the prophylaxis. And also guys, coming to the here, for the migraine guys, is the migraine, this is the migraine. Migraine, see, remember guys, there is a migraine is more common in female. There is a unilateral headache. And also guys, in the migraine, they will always mention the history. There is a the pain is more, the pain triggers the pain is more upon lighter sound. Okay, that's why if you have the headache, hey, please stop, please don't make any noise, please stop, please don't please try to switch off the light as soon as possible. How to say? Okay, now there is a water. Why there is migraine? Because there is a increase in the what? Increase in the secretion of what is a CGRP. This is your remember. CG is a calcitonin gene-related peptide. Okay, that's why guys, this is due to increase in the numbers of CGRP. There is a vasodilation. Whenever there is a migraine, just put here. There is a we will feel the pulsatile. We will feel the pulsatile. The pulsatile. That is the migraine. Okay, remember here, guys, this is what's the treatment of the migraine. For the mild to moderate, you can get the NSAID. Best one is the naproxen sodium. For the actual treatment is the triptans, like sumatriptan, sumatriptans. What is the mechanism of action? It is the triptans 5-HT1B and 1-CBD. BD, 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 BD. BD, okay? So 5-HT1B and 5-HT1D is the mechanism of action, and it is the and guys, remember the sumatriptan. Remember the sumatriptan. Sumatriptan is contraindicated in the stroke patient and in the heart patient. Okay, sumatriptan is contraindicated in what? Where stroke patient and in the heart patient sumatriptan is contraindicated. Remember, guys, in the earlier days, they were used to treat this migraine with the ergoids. Ergot, like example, methyl ergometrin, because it is also used in the treatment of the PPH, which causes the vasoconstriction, and there is a stoppage of the flow of the blood, and it causes the gangrene. That's why ergoids are contraindicated. Remember here, for the prophylaxis of the migraine, we can use the PPPP propanolol. If the patient is obese, then you have to use the topiramate. Okay, give the ectopyramid. I think is very clear, guys. Next one is the BPH and the prostatic cancer. Remember, guys, every time there is a one MCQ from the BPH or else in the prostatic cancer. From these two guys, there is one question. Remember this one, guys. You see here, this is the BP, see the what? Prostate. We have in the here, this is the peripheral zone, central zone, transition zone, guys. Remember this one, guys. Listen carefully. Listen carefully where they're going to test us in these topics. Okay. First of all, they will ask the BPH is commonly in where? Common in the more than 80 years old. But you have to start the screening after 50 years. But it's common in 70 above years. Okay. What is the most common symptom? It is the increase urinary frequency. Increase urinary frequency, the most common symptom. And what zone it involves? It involves transition zone. It involves transition zone. It is the, remember, it is the hyperplasia. It's not hypertrophy. It is a hyperplasia. Increase in the cell size. It's a cell number. Okay, na? This is the where in the transition zone there is a hyperplasia. Okay, na? Remember what is the harm? What is the main androgen? It is the DHT. Remember, guys, here also is prostatic cancer. It is more common in more than 70 years of age. What type of cancer? It is the adenocarcinoma. Okay, it is the adenocarcinoma. But see here, for the transition, it is the transition zone in the BPH, but in the peripheral, see PP prostate, PP peripheral. PP prostate, PP peripheral zone is the most commonly involved in the prostatic cancer. Remember, these are the important important MCQs. Remember here is the DTH, here is the increase in the testosterone. That's the BRCA2 is important, and the obesity, and the gene is the GSTP1 gene. And also you have to start the screening at 50 years. Screening must be digital examination and the PSA test, PSA antigen test. Here also see guys, here remember here on the DRE, digital rectal examination from the BPH, guys, we will see the form, rubbery prostate and mucosa over prostate is mobile. But remember here on the DRE here, the what? It is the hard, nodular, and the mucosa is fixed. Remember here, it's a DRE. Okay, remember the differences. Also remember here there is a investment of choice is the what? Ultrasound guided kidney urinary bladder and the truss guided true cut biopsy. And here also, guys, is the transrectal true cut biopsy. What enzyme is elevated here? This is the acid phosphatase. It is the acid phosphatase. Acid phosphatase is elevated. This is the MCQ. Now also remember, guys, here for the BPH raw. Remember what is the medical treatment? It is the tamsulosin is the for the symptomatic treatment. You have to use the tamsulosin. We can also use the finasteride, but the tamsulosin shows the improvement. For if the patient is hypertensive and the BPH, you have to give the prazosin. Okay, na? Surgery for that BPH, it is the TURP, the transurethral resection of the prostate. Remember, guys, for the irrigation while doing the TURP, for the irrigation you have to use the fluid is the isotonic glycine. What is the most common complication of doing the TURP? It is the retrograde ejaculation. The retrograde ejaculation is the most common complication. Remember, guys, after the surgery there is a clot, there is hemorrhage, and which leads to the clotting. For the irrigation of the clot retention, we have to use the three-way Foley catheter. This is the exam question. Also, guys, there is a dilutional hyponatremia, TURP syndrome, and the hemorrhage are the important complications of the BPH. I think you guys got it. Okay, these are the MCQs. Okay, next one in the here, guys. I told that there is a, remember here. So there is a what? Guys, remember the distance. There is a distant meta. There is a distance metastasis is most common to the bone. Here is the all the so metastasis will be migrated to the bones. Examples are the bones. Where it will go to the vertebral column. Vertebral column to where via via Batson's plexus. It involves the lumbar part. Mainly it causes the osteoblastic and the osteophytes. Remember for the grading of the prostatic cancer, it is the Gleason scoring. Symptoms like retention, hematuria, incontinence, ETI, and also guys remember here. And also for the TURP syndrome, if you are going to do the TURP, it also may lead to the prostatic cancer. These are the causes. Okay. Remember the PSA, it is the tumor marker for the recurrence. Remember for the treatment, it is the radical prostatectomy. Radical prostatectomy, it is the gold standard for the prostatic cancer. Remember here the most common complication is the impotence, is the erectile dysfunction. Also we have the radiotherapy and the brachytherapy. You have to use the ablation of what? Iodine 125 and the palladium 103. They are the important difference between the prostatic cancer and the BPH. Okay. Also, guys, next remember here, guys, this is the MI, myocardial infarction. Myocardial infarction, guys. Remember what is MI? Okay, now this is the what? This is the irreversible necrosis of cardiac muscle due to what? Due to prolonged ischemia. Prolonged ischemia. Remember, guys, we are having the total two types of MI. Total two types of MI. Okay, now STEMI, non-STEMI. ST elevated MI and a non-ST elevated MI. Remember, guys, remember here, this is the ST elevated. If we see ST segment will be elevated. But see, ST elevated MI will cause what? Transmural infarct. Enodome, ectodome, everything. All the less is going to affect it. Complete occlusion now. Okay. But remember here, non-stellar elevation, there is only endocardial. This is only endocardial infarction. There is only endocardial infarction. Have to remember this one. Okay. Na? So remember, guys, for the non-STEMI MI, you have to first of all you have to avoid the thrombolysis. For the unstable angina and the NSTEMI angina, for the unstable angina and the NSTEMI, you have to avoid the thrombolysis. What you have to give? You have to give the antiplatelets, anticoagulants, beta blockers, and you have to do the delayed PCI. Okay, management for the NSTEMI. For the STEMI, guys, you have to give MONA. What is MONA? M for morphine, oxygen, nitroglycerin, and this is an antiplatelet. Example, aspirin plus ADP receptor inhibitors. Example, see, first of all, you have to give the MONA. And also, guys, immediately you have to do the balloon angioplasty. You have to do the balloon angioplasty. That is the immediate PCI. That is the balloon angioplasty. You have to do the immediately. If the PCI is not performed in the less than 120 minutes, PCI not performed in the less than 120 minutes, then you have to do the fibrinolysis. Okay, fibrinolysis therapy, or else called a thrombolysis. With the what? Streptokinase 1.5 million units are tenecteplase plays 30 mg bolus IV and the alteplase 15 milligram IV bolus. And also first of all you have to give the 15 mg IV bolus, and later you have to continue to do the 0.75 milligram per kg at the infusion. Okay, na? And also here remember the thrombolysis is thrombolysis you have to contraindicate when there is a active bleeding. Exclude the mention. In mention you have to do the thrombolysis, bleeding disorders, recent ischemic stroke, and if they already did the thrombolysis within 6 months, you have to avoid the time. Okay, na? Remember, guys, this is going to be very, very important. Also remember, guys, how we are going to identify the MI, types of MI. Remember, guys, this is the ECG. I think you guys know about the ECG, guys. Okay. Oh my, so sorry. Are, Atra. Okay, guys, so sorry for that one. What sorry. Okay, see, And I think you guys know about the ECG. So guys, how you are going to identify this is either it is the anterior septal MI or anterior lateral MI, inferior MI. I think you guys know about the. Okay, yes, you know about there is a 12 leads. 12 leads, that is the hexaxial leads and the precordial leads. Hexaxial leads, how much are you have in the bipolar? One, you have in the 1, 2, 3. And precordial leads having the atra. See, precordial leads having 6. There is a what? There is a, this one raw. This is the augmented leads. Augmented leads are AVL, 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 AVR, AVF. AVL, AVR, AVF. They are the augmented leads. Okay, na? See, remember here, these are the chest leads. Okay, na? Always you have to see the graphs. Always you have to see. So, see, this is just one, lead 2, lead 3. Okay, na? Here we are having the AVL, AVF, AVR, and AVF. And here V1, V2, V3, V4, V5, V6. If the C, if there is any C, if lead 1 and 2 is going to affect it, then it is the chance of the anterior septal MI. V3, V4, V3, V4, anterior apical MI. And V3, V6, anterior what? Lateral MI. And there is a bipolar lead 1 and AVL. AVL, there is a lateral MI. And if there is a 2, lead 2, 3, AVF, and what? This one, V3 R and V6. It is going to be the inferior MI. Okay, now remember, guys, you just you have to know the basics. You have to know the basics, guys. Okay, now what leads are involving in the this one in lateral MI, in the inferior MI. Okay, now please try to go through this one. This is how you have to identify whether it is anterior or inferior MI. Okay, so it's very easy, guys. If you remember the basics, okay, now V1, V2. So V1, V2 for the septal. Okay, now at the lateral you have to V5, V6. So how you have to remember? So you have to identify the leads. Okay, now that's it. Okay. Let's remember, guys, this is the gross and microscopic pathology, the timeline here. Remember this is what this is the time you have to tell it. They are going to give a case like this one. Suppose they are going to use a case that there is a my patient, the heart is is yellow pallor and there is a hyperemia. Then please tell me the time of the infarction, post infarction. You have to tell it the 1 to 3 days, 1 to 3 days of the infarction. Okay, after death here. Remember here, TTC, triphenyl tetrazoleum chloride. It is the stain used to see the infarction portion of the heart. Remember, guys, for the 0 to 12 hours, there is no gross changes. Remember this one. 12 to 24 hours, there is a dark mottling. There is a dark mottling. After death, guys, these are the happening. You have to identify the. Remember this one. Okay, microscopy. There is hyperemia, yellow pallor. It is the 1-2 days. Like this, you have to remember the things here. How like this they are going to ask in the exam. Remember, guys, in the ECG, in the ECG, MI changes. Remember what is first is going to changes in the ECG. There is a first thing. There is a tall T wave. There is a tall T wave within 30 minutes. Second is that there is a ST elevation within the 1 to 3 hours. The third is the T wave inversion within the 12 hours. That's there is a pathological. There is a what? There is a pathological Q wave. There is a pathological Q wave within 24 hours. They will ask you within 24 hours. There is a what wave? Q wave. Remember this? They will just ask you Q wave is a pathological Q wave. Yeah, pathological Q wave. And also remember, guys, what is persist all is the ST, T wave, and also ST, T wave return to normal within the few weeks. This is how you have to remember. That's what I remember, guys, for the biomarkers, guys. Remember the biomarkers for the IMA, ischemic modified all movement. This is the guys. If they, for example, they ask the question, if these are not in the option, if they are in the option and this is also in the option, then you have to mark the first one, this one, IMA. IMA is the very, very earliest one. Okay, now even though they given the CKMB HFAB, BP, and also they mentioned the IMA. Then you have to go with the IMA. IMA. Then a very earliest day one. First range is the HFAB. Second is the myoglobin. Maximum is the troponin INT. CKMB is for what? Reinfarction. Remember that for the reinfarction is the CKMB. Okay, na? Remember here. This is how you have to remember this one. Okay, done, done. And also, guys, remember this one types of conjunctivitis. Here, remember this one. They will give the history. A young boy came to ophthalmology OPD. Chief complaint of itching, redness, and history of using contact lenses. Oh my goodness! See if they having the if they show the itching, redness, history of contact lenses, then you have to go with the giant papillary. This is the giant papillary conjunctivitis. This is the giant papillary conjunctivitis. You see the young boy using what? Contact lenses. The giant papillary conjunctivitis, you have to give the olapatadine is the antihistamine drug. Remember, guys, for the VKC here, this is the cobblestone appearance. There's a cobblestone appearance. Okay, if they will give the history as there's a spring catarrh. Okay, boy with the history of in the spring catarrh. Chief complaint the itchy, ropey discharge, more in summer season. Oh my goodness, see, summer season, spring catarrh, summer season, itchy, and ropey discharge, male history. There is a shield also. Yeah, favor to the VKC, it is the vernal keratoconjunctivitis. That's remember, guys, these are the yellowish nodule. These are the yellowish nodule. It is the type 4 hypersensitivity reaction. Remember, guys, sometimes they are not going to give the images, but they just give the okay. She got this type of conjunctivitis, but there is a yellowish nodule. There is a yellowish nodule. Then you have to okay. They're asking about the flightular conjunctivitis. Okay, done. Next one, guys. Remember this one, guys. Yes, very, very simple here. Okay, so for the CSF interpretation is very, very easy, guys. Okay, remember, guys, CSF interpretation is very easy. Okay, see this one. Remember in my style. Okay, see, this is the pyogenic, also called as bacterial, TB, meningitis, viral meningitis, fungal. Okay, no need fungal. Just wait long. Okay. See, remember this is the viral. This is the viral. See, viral, normal, viral, normal. See, in the CBC report, when you're seeing CBC report, if there is a more lymphocytes, then what do we mean? There is a viral infection. Mama, if your lymphocytes is very high, it means viral. That is normal. See, viral and normal. See, in viral, all are normal. Only lymphocytes are increased. That's why this is the viral meningitis. This is what you have to see. Normal, viral, all are sick. Color is also clear. This is the what? What amma? It is the viral infection. Viral meningitis. Remember, guys, here the bacteria are pyogenic. Remember right here. See here. Bacteria. See, bacteria loves to eat glucose. Bacteria loves to eat glucose. If the bacteria is eating the glucose, then what is the value of the what is the volume of the glucose? Low. If the bacteria eating the glucose, then what? The quantity of the glucose will be reduced. That's why see here in the bacterial meningitis and TB meningitis also caused by mycobacterium. In the case of the bacteria and TB, there is a glucose level is always down. Got it? Glucose level is always down. Okay. See, in the CBC report, guys, if there is a neutrophils, in neutrophils there is, if it is increase, neutrophils, if it is increase, it means what? It is a bacterial infection. Everyone knows. See, very easy, very easy. Bacterial is increased. See, neutrophils, everyone knows neutrophils increase means bacterial infection. Glucose is always decrease. Okay, this normal. See here, guys, very easy. Bacterial, what? Neutrophils high, glucose obviously low because bacteria has to eat glucose. Done, done. Okay, next, coming to TB. Remember, guys, in the TB, what happens here is the TB. See, guys, bacterial There is a unique what is there is a neutrophils here. Remember guys here for the TB and viral, there is a what? There is a lymphocyte. See, lymphocytes are more here. Lymphocytes are more in the TB and the viral. But how you are going to remember the viral? Viral are normal. All are normal. Okay. All are normal. Okay, you have to remember this one. In the TB guys, there is a what there is a maximum. They will say the TB there is a protein is going to be more than 100. There is a more number of protein in the TB meningitis. The more number of proteins, they will going to form the spider like they form the spider like web formation. There is a spider like web that is called a cobweb formation due to more protein in the TB meningitis. This is the thing you have to need to identify in the TB. They mentioned that there is a maximum increase in the protein, maximum increase in the protein that is the more than 100. They will mention 300. In the protein, all are going to be normal, but in the TB meningitis, there is going to be the more than 100. Okay, now see, as I told you that glucose is decreased in the everywhere. Glucose in the everywhere. Okay, please see. Okay, done now. See, bacterial turbid bacteria. Yeah, this is how you have to remember, Ra. Very easy for you. Okay, na? What sound, Ra? Okay, done. And also, guys, please remember this one. Please remember this. I will come with the fungi also. Okay, now. Open Ra sound low. Okay, okay, then okay. So see here, guys. See here, guys. Oh, Ognism. Okay, see guys, see, remember, and also coming to the fungal Ra. I will tell you about fungal. Remember, guys, what you have to remember here for the 0 to 2 months. What is the most common cause of meningitis? Is the in India it is the E. coli. In the worldwide it is the Streptococcus or Staph aureus. Remember, Ra, for the children it is the meningococcal. See, children will love ma. This is the meningococcal. Adults like Papa pneumococcal. Done. Remember here, guys. Just remember here, Ra. See here, this is the Cryptococcus neoformans. Remember here, one thing remember here, it causes the cryptococcal meningitis. Okay, na? See, for this one, they will give the history of the HIV. There is a HIV patient and there is a lung involvement. Lung involvement plus they give the history of patient is a HIV patient. Then you have to mark the answer as the cryptococcal meningitis. Okay, cryptococcal meningitis. See the history of HIV and the lung involvement. Remember the cryptococcal meningitis. You have to give treatment. What? Treatment is a IV amphotericin B and the flu cytosine followed by flu conjugate for the cryptomeningitis. Guys, remember, guys. Okay, remember here. Guys, remember the what here? Remember there is a due to pigeon inhalation of the spore. Remember you have to highlight with the India ink. You have to use the what? India ink. Okay, na? Done na? Okay, this is what you have to remember with the Cryptococcus neoformans. Okay. Lastly, guys, remember this one, Ra. Please remember this one, Ra. Okay, the fungus. Here, remember. See, this is the Aspergillus fumigatus. Sira, remember this is the what? Aspergillus. C, A means C, this is the acute angle, S means septate. Means it is having the acute angle and the S for septate hyphae. Done. They will clearly mention you in the examination, guys. There is a for acute, there is the hyphae is acute angle, there is a septate hyphae. Okay, now. And these are the causes of invasive aspergillosis in the immunocompromised patient. In the immunocompromised patient. Okay, na? And also, guys, it causes the aspergilloma. Causes the aspergillomas in the what? In the pre-existing lung cavities. Where ma? In the lung cavities. Okay, lung cavities is an important one. Also remember this was the treatment will be the varicocele. Okay. Always they are not going to give the images only. They are going to describe the image, the acute angle septate. Remember for the mucor and the sera, from the mucor and rhizopus, as you know that aspergillosis is the acute and the septate, and the remaining mucor and rhizopus are they are going to be the non-septate, and there's a wide angle, wide angle. Mainly in what patient? Patient with the DKA or with the neutropenia patient. Okay, ra? This one. Done no? DKA neutropenia patient. You have to see this one. And also see the there is going to the rhinocerebral frontal lobe abscess. And also involves the cavernous sinus thrombosis. What is the cavernous sinus thrombosis? Treatment is the surgical debridement and amputation. Remember this one. Remember this one. Chromoblastomycosis. Chromoblastomycosis. There always they see a farmer went to something with barefoot. He got the history of trauma. After that, he got the varicose leaves, cauliflowers like leaf lesion here on the foot. Then the diagnosis is the what? It's the chromoblastomycosis. We'll see the MMS body, that is the C medullary, muriform, and sclerotic body. We'll see the, and also we will see the copper penny bodies. They are the important points to remember about the chromoblastomycosis. Treatment with the amphotericin B and cytosine. I hope you guys enjoyed the session, and I think you learned something. Okay. Thank you very much, guys. I will just see you in the next session. Thank you very much.